and welcome to Esther's Laguna Woods Show, where every guest matters. Today we have a very special guest. Her name is Dr. Jane Mahakin, and today we're going to talk about dementia. Hi, Jane.
Thank you. Good morning.
So nice to have you here.
It's a pleasure. Thank you for inviting me this morning.
Thank you for coming.
Sure.
So what is your background?
Oh, sure. I'm happy to talk a little bit about what I do. I'm a local gerontologist, and I specialize in working with people that have memory impairments. And my background is I have a PhD in clinical psychology, and I was very fortunate. I did all of my training at the Veterans Administration hospitals.
Wow, really?
Many years ago.
Yeah.
Yes.
It's interesting.
Thank you.
Yeah, that's interesting. So now you are a care manager? What is that mean?
Yes.
What does that mean?
I'm a gerontologist and care manager.
Yes.
So care management is a fairly new profession, maybe 20 years old. And what we do and what the care manager does is we are advocates for the person that has, for example, I specialize in people with memory impairments.
Yeah.
So monitoring of care, advocacy. The care manager will look at what are the options in the community that are best for that person, and then have consultations with the person, their family, and to see what would be the best option for them. Once options are chosen for living, let's say, for example, in selecting an assisted living community or a memory care community,
Yeah.
the care manager may and usually gets involved in monitoring the care and making sure that person has a successful transition, because you don't want to move again. You know, once you move and choose the community, you want to have that community work, and you want to have it be a positive and successful experience. So care managers really are kind of like information hubs. We know the resources out there, and we can match the person with resources of every socioeconomic, from people who need information about Medi-Cal to people who want information on what is the best nursing home or rehabilitation home. So that's what care managers do. We're kind of like social workers.
You're like, do you visit people?
We do. I do.
Yeah?
I do visit people.
Yeah.
I visit people in the hospital,
Yeah.
where I may speak with the nurses, speak with the hospitalists, and then maybe monitor the care there and see what I can do to
Really?
improve the care in the hospital.
Wow.
Mhm.
Did it ever happen that you had to move one person from one place to another?
Well, unfortunately, it does happen, unfortunately.
Yeah.
I think what happens is that it's very important for the person to trust where the information is coming from.
Yes.
So the care manager is your objective, neutral professional that knows the resources in the community.
Yes.
For example, somebody maybe 6-7 months ago chose a memory care community for his wife.
Yeah.
And it was not the right match for his wife.
Yeah.
The staff was not properly trained.
Yes.
And while the community was beautiful aesthetically,
Yes,
it was
yes.
not providing good care for this person. So I was hired by the family to look
Move
at
them.
what was going on,
Yes.
and then help that person transition to a better match community, a community that really better, met her needs.
You said that people with Alzheimer's, they have feelings and they should be in a good environment. That
Absolutely.
makes a big difference. Huh?
Absolutely, it does.
Really?
It does. What happens many times is when people have advanced memory impairments, like
Yeah.
Alzheimer's disease,
Yes.
staying at home, there's really not a lot of things to do at home.
Yes.
Even with the best and well-trained caregiver, there's not too many activities at home.
Yes.
And people become bored, and then people become depressed.
Yeah.
So this is a consideration of really choosing the best living environment for that person, or daycare programs too.
Yes.
There's many different kinds of programs and resources for people with impairments,
So-
cognitive impairments.
So they feel things.
They do feel
they
things.
still feel things.
And what happens is the feelings never will go away, even as the disease advances.
Yeah.
Even in the latter stages of the disease, that person is still there. They can feel. They may not remember who I am
Yes,
or my
yes,
name,
yes, yes.
but they recognize me.
Yes,
They
yes.
have that connection.
Yes, yes.
So they will remember, even though they cannot articulate it
Yes,
because
yes.
of language disruptions.
Yes, yes.
They can still feel, they know that that's their son, they know that that's their daughter on one level. And so the environment makes a really big difference in choosing a community, because they are affected by what's going on in the environment.
You told me you can still talk to them on their level. Like, let's say somebody was a real estate agent.
Oh
You
yes,
told me
yes,
about that.
exactly,
And
right.
you talked to her about real estate. And
Exactly. It's all about learning their language, and it's really jumping into their shoes and
Yes,
being
yes.
where they are in time.
Wow.
So it's not about your agenda or what you want them to do.
Yes,
It's
yes,
really
yes.
figuring out and finding out where they are and where are they in time. My client may believe that I did real estate with her,
Yes, yes.
and I was a real estate colleague. And so our connection is more about our work together, even though that's not real.
Yes, yes.
So I will validate and empower her to validate her ideas and her positive thoughts and
Yes, yes.
delusions
Yes, yes.
that that's real.
And
Even-
it makes her happy?
and it makes her happy, exactly.
Wow.
It's very powerful.
Wow.
And it's a powerful intervention to use to reduce agitation
Yes,
or
yes.
irritation.
Yes. Just talk to them.
Just talking to
whatever they
them
want to
and,
talk about.
and validating their reality,
Yes,
as
yes.
long as it's a positive reality.
Wow.
If it's Esther, if it's a negative thought or
Yes.
a negative delusion,
Yes.
then being able to turn that around
Yes.
and having them look at something positive or introducing something positive as a distraction
Yes.
will help reduce that behavior too.
Like what? I mean, how can you change? I mean,
It's
I mean, if she starts talking about something else, or
Exactly.
something, just go along with
if it's something negative and not positive, you can use distractions and get them off that topic.
that. Uh-huh.
It could be introducing an object to them,
Okay,
something.
okay.
It could be giving them their favorite treat.
Okay. Okay.
It could be talking about yourself in a
Okay.
positive way.
Okay.
It could be asking for their help. Okay, even people with advanced dementia, we all want to help, and we all want to have meaningful lives.
You ask who for help?
I may ask my client for help.
Really?
Mm-hmm.
And they respond?
And
to
they
it?
respond, because that makes them feel like a sense of self-efficacy.
Oh.
And it makes them feel that they're having some meaningful conversation with me.
Wow. Wow. So you started a memory clubs? I mean, how many do you have? You have a few of them.
Well, the last count, Esther, we have 6 here in South County.
Yeah.
The Memory Club started about 2.5, 3 years ago at the San Clemente Library.
Yeah.
And they were so popular there, well attended, that they've just taken off.
Wow.
So I have 6 memory clubs, and I have a fairly new memory club here at Laguna Woods, which is very
In the
exciting.
city, yeah, city of Laguna Woods.
Our next memory club will be August 15th.
Yeah.
In the City Hall, and that's
So what do you do in the memory club?
well, that's a good question. You'll have to come and see.
Okay.
We have people as young as early 50s attending the Memory Club.
Really?
So it's pretty much all research-based information and education about memory and brain health. But we also do some games. We
Yeah.
also do different types of memory-enhancing type techniques that will help that person with their short-term memory. I also may do some reminiscence work, which is looking at long-term memories, because that's important too. So every class is different, and every class does not build on each other. So essentially, a person could attend all 6 during the month and have a different class.
Wow.
Which I do
go
have-
to different places.
I do have some people who they call themselves groupies of
Yeah.
Dr. Jane,
Wow.
and they follow and they go to each club, which is really cool.
Wow.
Uh-huh.
So So who should come to your club?
Well, everybody here. People, you know, as young as early 50s, people are coming. People with age-related memory hiccups,
Yes,
memory
yes,
loss.
yes, yes.
People with mild cognitive impairment are
Yes,
coming, and
yes.
people who have a diagnosis of Alzheimer's disease are attending my memory clubs.
What is considered normal memory loss? Forgetfulness.
Well, that's a really good question. Occasional lapses in memory are really a normal part of aging. For example, forgetting a person's name that you just met last evening. You know, these kind of what we call tip of the tongue phenomenon.
Okay.
You know the name, you met them,
Yes,
you
yes,
can't
yes,
remember.
yes, yes.
And then it comes back to you.
Yes, yes, yes.
Occasionally forgetting where you put items, such as your keys. So losing keys in the house or misplacing them, shall we say, is common. Forgetting sometimes that you have a doctor's appointment that you had scheduled maybe a month or two ago. Yes,
okay.
it is common.
Yeah.
And that's normal.
What about looking for glasses while you're wearing them?
Oh, that's funny. Well, I have to tell you, Esther, that has actually happened to me. And it sounds like that's happened to you too. And that is really normal.
Yeah, okay.
That is normal.
Okay.
Or perhaps, you know, making a phone call and the person says hello and you forget who you're calling.
Oh my God.
And why does that happen? Because we're doing too much. We may be doing 4 or 5 things at the same time. We got interrupted by somebody.
Yes, yes.
Okay, it could be your pet, it could be your significant other that came into the room. You know, it might be too much on your mind.
Yes.
These are all part of distractions of why people forget.
What about parking? Sometimes you forget where you park.
Well, that's a really good, you know, that's why, you know, years ago, Walt Disney, right? He has those, the parking lot has the characters.
Yes.
Why do you think that's so? So you remember you parked in Mickey Mouse, you know, lane, right?
Wow.
There, you can take a picture, which
Yes,
is a good
that's what I
idea.
said.
A good idea.
For people, if they go to a
You can take a
big store
picture
like
using
Costco,
your
for
phone,
example,
like Costco.
it's like so many cars, so you just walk away and take a picture.
True.
From far away.
Which is
This way you
helpful.
which is helpful.
As long as you don't lose your phone.
Yeah.
That's true.
No.
But it's common. You go to the mall, you come out, you've been shopping for an hour or two, and you can't find your car.
It's good to take pictures.
That's normal. If you don't remember your car, then that's not normal.
Let's see. How many types of dementia are there?
Well, the leading type of dementia, and dementia is, let me explain what dementia is. It's symptoms.
Okay.
Dementia is really not a diagnosis. It's a constellation of symptoms.
Okay.
Alzheimer's disease is the most common form of a dementia. Second would be vascular dementia. There's also frontal temporal dementia, which affects the person's frontal lobes.
Yes.
There's Parkinson's disease. There's Korsakoff dementia, which is
What is that? Never heard that.
caused by excessive alcohol use,
Oh,
chronic
really?
and hard alcohol use through the years that causes this.
Really?
There's dementia with Lewy body disease also.
What is that?
It is a mix of Lewy bodies with sometimes with Alzheimer's disease. You'll see that as common too.
They're like the most.
So that's why it's important to have a neurologist on your team. You want to be able to have a proper diagnosis.
Yeah. Is there a test that people can take?
Honestly, there really is not one test if someone has a dementia. There's not one specific test. It's really a comprehensive evaluation by a neurologist, which would include the blood work, the physical examination, CT scans, MRI scan, neuropsychological evaluation testing by the neuropsychologist on the team that works with the neurologist, to really have a comprehensive evaluation, and looking also at that person's history. So their health history also, and medications will come into play.
So we talked about the options for Alzheimer's, did we? We talked about that. Okay. What about what kind of memory exercise is best?
Well, studies have shown that number one thing that you can do is exercise. So walking is number one. Number two would be swimming if you have access to a pool. Number three would be stationary bicycle.
Really?
Mm-hmm. So these kind of physical exercises should be done anywhere from 30 to 45 minutes a day. That's what researchers state. These kind of exercises are important for physical because they will affect the brain health,
Yeah.
but also playing cards.
What kind of card? What
Any
kind?
kind of card game would
Really?
be fantastic. There
Yeah.
is a local neurologist
Yeah.
who shares with his patients that playing the game of concentration with the cards, where you're placing the cards face down and then making matches one by one, is a very good memory improving, short-term memory, working memory card
Wow.
game.
Wow.
Any kind of puzzle, yoga,
Yeah.
meditation,
Yeah.
gardening, if you can
Yeah.
do gardening, is excellent.
Yeah.
Any kind of cognitive game online on your iPad is excellent also.
Is there any like website for that?
There are many websites. One of my favorites would be probably Brain HQ. There's Lumosity. There's Elevate, which is free.
Yeah.
Elevate.com is a free website
Yeah.
for brain games.
Yeah.
Socializing with friends, making a new friend, anything new, such as learning a new language.
Ah.
Any type of art class that maybe you've never had an art class
Yes.
before is very good too. So anything new that you can do is going to be imperative and important for starving off a dementia or slowing the progression if you have a dementia down.
Yeah, that's what my next question would have been, like how to delay dementia. So this is part of that.
Well, you know, researchers are still investigating how the disease develops, right?
Yeah.
And there's really no certain way to slow down or prevent dementia. But recent studies this month have shown that it's exercise and cognitive games that will slow and maybe even starve off the onset of a dementia.
I believe in water. Drink a lot of water.
Oh, yes. Water
Water is
important.
medicine. Water, just drink a lot of water. I mean,
Well, then that leads into healthy eating.
Yes.
And so diet is also right up there with exercise. Researchers have shown that even if you have a genetic predisposition to Alzheimer's, the healthy diet, the healthy lifestyle is what you want to incorporate. So healthy eating, such as Mediterranean diet.
Oh, yes. Yeah, that comes to another question that I want to ask you. What country has the least dementia and what country has the most?
The least cases of Alzheimer's disease and other dementias is India. India.
I wonder why. What
You
do
know,
they eat?
Their diet is very different. So a
Yes.
lot of curry-based meals
Yes.
and spices.
Yes.
And they also do a lot of walking. So and bicycle ride, you know, they're more active in this country.
Oh.
So there are other factors too. Low obesity rates.
Okay.
So less of an incidence of vascular type dementias also, because their cholesterol levels are lower, and there's a lower incidence of diabetes also in that country. So all of these factors play into why it's low.
Do they live long? I mean, is that the thing? I mean, what's the, I mean...
You know, worldwide, people are living longer than any other time before in history.
Yeah.
But we're also living longer, but we're living also with more chronic diseases.
Yes.
So that's why it's important. At any age, it's never too late to start. It's never too late to start exercising. Whether it's, you know, an exercise class or, you know, walking, it's never too late to make these changes.
What places have the most dementia?
Well, the most dementia, the top countries who are most affected by Alzheimer's disease, for example, is Finland, United States and Canada and Iceland. These are all top countries that are affected most by Alzheimer's disease.
I wonder why.
You know, that's a very good question. Again, it goes to...
Could it be the weather? I mean, it's cold there? I mean, I don't know.
It goes to diet.
Okay.
It goes to levels of stress.
Yes.
All these different factors. History of stroke, incidence of high blood pressures, obesity, all these factors play into the rates of the incidence of Alzheimer's, prevalence of Alzheimer's disease.
What about, I heard somewhere that if somebody has a B12 deficiency, what about that?
That's very important to have your general practitioner, your primary care doctor, check your blood levels, once a year, twice a year, whatever he or she recommends, and look at vitamin B12, because sometimes the vitamin B12 deficiency can actually look like what we call a reversible dementia. So they'll have the memory problem, they'll have maybe some confusion. Once those, it's easy to treat, you take vitamin B12.
Yes.
Once it's treated, those symptoms go away.
Wow.
So that's why it's
something?
very important. Very important.
So, how long does it take to get into a memory care? I mean, certain places are easier than others.
You mean care options?
The care options, yeah.
Well, it depends. Every memory care community is different. You don't want to choose a memory care community based on aesthetics. You really want to get to know that community. You want to have guidance also. So again, that care manager, the social worker, is going to be able to give you that guidance on what's the best for your loved one.
And the money.
And of course. So with that person's budget, that community must fit, of course, the budget. You don't want to choose a community that's too expensive.
Yes. Cannot pay for it.
And some communities are smaller, where you're going to have less, it might be less, the stimulation is going to be different. It depends upon the kind of memory impairment that person has in terms of selecting, and the best communities do have waiting lists. There's no doubt about that.
So who's paying for that?
That's a good question. If a person is lucky enough to have long-term care insurance, then the long-term care insurance will pay for the assisted living or memory care community. If not, it's the private monies of that person or couple or family.
You told me that sometimes people put their loved ones in a crazy mental institutions instead of care.
Well, sometimes what happens is, it's not by choice, of course, is what happens is sometimes the person's behavior becomes so out of control, and sometimes they do not have a neurologist on their team providing that guidance medication-wise. And the person's behavior may change, so much so that they're at risk of hurting themselves or other people. And that's where the psychiatric inpatient stay would be required to fine-tune their medications and to stabilize that person. It's of course it's a stressful, traumatic, and not ideal. It's temporary. Once they're stabilized, then that family would decide on the next step. And many times I help families make that advisement on that next step, whether they're at home and the care is becoming too much at home, or they're in the inpatient psychiatric hospital or in the hospital, and what is the next step, and how best to transition that person to that respective community.
You wanted to talk about the different volunteering work that you do. What kind of work?
Oh, sure. I'm happy to speak with you about that. In my free time, several years ago, I started a nonprofit here locally called Alzheimer's Care Armenia. And Alzheimer's Care Armenia is launching different programs, including memory clubs in Armenia.
Really?
There are virtually no services or programs for people with memory loss in the country.
Yeah.
It's a poor country.
Yeah.
And there's very little being done for older adults.
Yeah.
I saw the need, and I travel quite frequently to the country.
Yeah.
And it's amazing, but people are enjoying the several memory clubs that are now in place.
Wow.
And so that's leading to other programs that I'm developing to help the whole country.
Like what?
Well,
Developing? What are you developing?
I'm working closely with their government, with their ministries of health and ministries of labor.
Wow.
To create a national dementia plan.
Yeah.
And to also create some programs that will provide information and education.
Mm-hmm.
I've partnered with Silverado, which is a local company specializing in memory loss here in Orange County.
Yeah.
And they're providing, along with me, some virtual education on dementia for healthcare providers there. So once a month we have a dementia training for healthcare providers in Armenia, which is really well attended. So I'm really, it's a meaningful cause because it's making a difference in those people's lives.
How wonderful.
Yeah, thank you.
Going back to food, I read somewhere that olive oil is supposed to be good for you.
Yes, yes. Olive oil is preferred. It is then butter or any kind of other soluble fat.
Yes.
So olive oil is excellent. Just like avocados are really, really good power brain foods.
Yeah.
Walnuts is right up there.
Yeah.
Chocolate, dark chocolate is also a really good brain food. But olive oil is
chocolate? You mean dark chocolate?
Dark chocolate. Yes, yes, yes. I recently had one of my dear clients who I have seen quite, usually I see this person once a week.
Yeah.
He reported he was eating chocolate every day. I said, well, that's really great because that's really great for brain health. Only to learn from his family that he was eating chocolate for breakfast, and that was his breakfast. And so we had to kind of make some changes because
wow.
So now he has a snack, a little bit of 4 ounces of chocolate every day as a snack. No longer for breakfast, but chocolate is a very good for brain health.
So anything else? I mean, how can people help themselves? I mean,
that's a good question. Right.
Let's
right,
say
exactly.
somebody's alone
Right.
and they see that
Right.
the mind is not as good. I mean, how can? Who
Well,
should they call?
Well, the first call should be their primary doctor.
Yeah.
That's the first call. If they notice in themselves or their loved ones some changes, I would call the doctor, because sometimes and usually these kind of cognitive changes are reversible. It could be something as simple as a urinary tract infection that's causing confusion.
Wow.
Once the urinary tract infection is treated, that person's no longer confused or having memory impairment.
Wow, really?
That's the first step.
Yeah.
They need to be an advocate for themselves.
Yes.
Just as I am an advocate for older people, looking out for them and providing guidance for the family and for the person, they can also be an advocate for themselves. If you don't hear back from a healthcare professional, call them again.
Yes.
Don't wait 4 days. Call again and make that call, and gently be an advocate. Gently push for what you. Usually you're right, and trust your instincts on
instinct.
That's right, correct.
Instinct is the best thing.
Instinct is the best thing.
Yeah.
Right, correct.
Well, it was so nice having you here.
Thank you very much.
Nice having you here.
It's an honor, and thank you for inviting me this morning.
Thank you for coming.
Thank you.
We got a lot of information. Anything else you want to add? Or
no, I think
everything.
I think we covered it quite well. Thank you.
Thank you.
Okay.
Thank you for watching, and next time we'll have another interesting guest. Thank you.